Hi, everyone. Welcome back to Time 100 Talks. I'm Edward Felsenthal, Editor-in-Chief and CEO of Time. Time 100 Talks, if you haven't been with us before, is our virtual program where we bring together leaders from all over the world and across fields to spotlight solutions and encourage progress. Today, we're going to talk about lessons in crisis, lessons from crisis. How do we build a world out of the multiple crises we're living through that is more just and more resilient? As contributor and Princeton professor Eddie S. Glaude writes in this week's issue of Time, the videos of George Floyd and Rayshard Brooks dying have combined with the vulnerability caused by COVID-19 and the feeling that the country is broken to bring us all to the brink of madness and apparently to the precipice of significant change. Our topic today is what will come of this moment? Will we see the significant change that we all know the world needs? That's the focus of today's program. Joining us is former Democratic presidential candidate Andrew Yang, an entrepreneur and the founder of Humanity Forward. He'll be speaking with Time's Lysandra Villa about his vision for the future of the American economy. Dr. Robert Redfield, director of the CDC, is also with us. He'll talk with Time's senior health correspondent Alice Park about how to reopen safely and what lies ahead during the continued response to COVID-19. Katie Couric will speak with civil rights icon and activist Ruby Bridges about why the current protests make her hopeful about the future. And platinum recording artist Jordin Sparks will join us to talk about how artists can make a difference at this moment, and she'll perform 2 great songs. I'd also like to thank our partners, State Farm, for making today's program and conversations possible. And now, to kick us off, Jordin Sparks will perform her song, Unknown.
Used to be a lot I thought I knew for sure. Funny how pride is silenced in the storm. Low peaks, valleys, high, blinding silver lines. Don't always want to buy the lesson that's in store. So tell me, can you hold me? Comfort me when I start feeling lonely. Sometimes I let my feelings control me. And a lot of people love me, but you know me. I'm trying to find my place, keep my pace, make my waves. But I can't push the weight in my strength. I need your grace. I know I can't do this alone, 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 alone. Can you see me through the unknown, unknown, unknown? I can't do this alone. I don't always win the battles in my mind. Surrender to it all and know that I'll be fine. Running from my truth, that's a race I'll lose. Falling on my knees, but still I rise. And that's because you hold me. You comfort me when I start feeling lonely. And still I let my feelings control me. And a lot of people love me, but you know me, you know me. I'm trying to find my place, keep my pace in this race. But I can't push the weight in my strength. I need your grace. I know I can't do this alone, 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 alone. Can you see me through the unknown, unknown, unknown? I can't do this alone. So tell me, can you hold me? Comfort me when my heart's feeling lonely. And still I let my feelings control me. And people say they love me, but you know me. I'm trying to find my place in this race to keep my pace. But I can't push the weight in my strength. I need your grace. I know I can't do this alone. alone. Can you see me through the unknown, unknown, unknown? We don't have to do this alone.
Thank you, Jordin, for that amazing performance. We look forward to speaking with you later in the program. And now I'd like to introduce my colleague, Time's Lysandra Villa. She'll be joined by Andrew Yang for a conversation about how to build back the American economy.
Thank you, Edward. Hi, everyone. My name is Lisa Villa, and I'm pleased to be joined today by former Democratic presidential candidate Andrew Yang. Mr. Yang, thank you so much for taking the time to speak with us today.
Oh, it's great to be here. It's great to see you, Lisa. Last time I saw you, we were on the trail in New Hampshire, I believe. Is that correct?
More than a year ago now, when the world was very different. Let's start with two of the subjects that have been dominating the news the last several weeks and months. First, the racial justice protests that have broken out in the wake of George Floyd's death in Minnesota. I'm wondering what you think the federal government needs to be doing in order to combat the systematic racism that clearly exists prevalently throughout the United States.
The federal government needs to do much, much more around this issue of police brutality and injustice. I'm a numbers guy, and so I started trying to dig into measures of the scope and magnitude of this problem, and it's massive. We have 1,000 people die in police-involved shootings every year that we know about. The data is actually unclear, despite the fact that police departments are supposed to report this data. And you have municipal police departments paying out $1 billion a year or more in civil judgments against police officers based upon police brutality and misconduct. So this is a massive problem, and our federal government needs to make huge changes in order to rein this problem in. So some of the things that are being proposed at the congressional level right now are the right moves: banning chokeholds. We need to have more Department of Justice oversight, because the fact is local district attorneys do not want to run afoul of local law enforcement. They work with them every single day to prosecute cases. And so then to have them turn around and say, hey, there's this bad cop that we need to get rid of or bring to justice, it's not realistic. Kamala Harris, who's been in that seat, said the same thing. So we need more federal oversight. We need to demilitarize our police departments. We've literally sent billions of dollars in military hardware to them free of charge. So we need massive changes, and the federal government is the only entity that can realistically make those changes. The American people are nearly unanimous on the need for these changes, and I certainly hope that Congress starts moving the George Floyd Act through to think bigger about how we can solve this problem. And then there's the bigger landscape of racial inequities, which to me, it's even more pervasive than this police brutality issue. We need to reshape our economy so that it works for more people who right now are being pushed aside or left behind.
As you've already highlighted, this is a huge issue that a lot of people are having discussions about at home. I know that you have a young family, and I'm wondering what some of the conversations on the topic of racial injustice have looked like at home for you.
My boys are very young. They're 7 and 4. The 7-year-old is autistic, so they're somewhat oblivious, honestly, which is kind of a blessing right now. So we've talked to them about the coronavirus. That's why they were pulled out of school, obviously. We have talked to them about George Floyd and the fact that that Black people in our country are unfortunately treated differently and subject to violence that other groups are not. Do they understand these things? I'm not sure, but it did seem important that we at least try to expose them to it, given the fact that this is happening in their country, in their world.
You raised racial inequalities already. I wonder, would you support the calls for reparations?
It's clear that this country was built on the backs of slaves and that we owe them a massive debt. And I'm for HR 40, the bill that explores what reparations would look like. To me, there's an intermediate step where we need to reshape our economy so that it's working for all of us. And then we should move directly towards considering and weighing reparations. but we're facing an economic catastrophe right now that faces all Americans, unfortunately, not just descendants of slaves, where we've lost 40 million jobs that we know about, and economists project that 42% of those jobs are gone for good. So you're looking at 17, 18 million jobs gone forever. The Great Recession at its peak cost us 8.8 million jobs. So you're looking at 2 times the Great Recession in perpetuity as far as the eye can see. This is what we need to address immediately before we can look at digging into some of the even deeper historic inequities that have existed in this country, unfortunately, for generations.
Just to hone in on that a little bit more, your signature proposal during the campaign was the universal basic income proposal of giving Americans $1,000 a month. Why are you a proponent of universal economic action versus the more targeted ones like reparations?
Well, we're in the midst of a new Great Depression in terms of unemployment, and it's not any one group of Americans that exclusively are suffering right now. I mean, if you look at New York City's real estate, I just saw a stat that it's 95% unoccupied, these commercial buildings. And so all of the pizza shops and coffee shops and like vendors that were relying upon people going to their office just to sell like a cinnamon roll to or whatever, like everyone is suffering right now. Like we need to try and put out the fire that has enveloped our economy, which right now, to me, the stimulus is headed backwards, where we've given 80% of it plus to large corporations and maybe 10% of it directly to families who are struggling right now. We should have reversed that. We should have put much more into households. There's a bill right now in Congress around emergency cash relief of $2,000 a month for families until this crisis is passed. To me, that's where we need to focus because the unemployment benefits are going to expire at the end of July. The moratorium on evictions from millions of apartments are going to end in August. We're going to see millions of Americans out on the street in desperate circumstances in the next number of days and weeks unless we take dramatic action right now.
Of course, any legislation and executive action is deeply entrenched in our politics. To that end, the president recently referred to COVID-19 as the Kung flu, a racial slur that I know that you called him out on. He also recently referred to racial justice protesters as hoodlums. I'm wondering, in a moment that America is clearly having a reckoning over race and privilege, whether you worry that the president's language and rhetoric will continue to have a lasting effect on America after he leaves office.
I believe that millions of Americans want us to come together. It's one reason why I believe Joe is going to soundly defeat Trump in November and that Joe will be our next president because we want to come together as a people. We want to begin healing. And we all know that Trump's racially divisive rhetoric has been part of the problem, not the solution. Right now, we're all desperate for a better approach. And I believe Joe Biden is going to be the person that leads this country over the next number of years to begin the healing process.
You've already started addressing some of the additional aid that you think Congress needs to give Americans in the face of these upcoming challenges that are still all related to coronavirus. In the current political climate, how likely do you think it is that Americans will receive the aid that they need?
I'm optimistic that Congress will see reason and do the right thing in terms of emergency cash relief. I saw a survey that said that the vast majority of Americans want cash relief, including a majority of Republicans. If you go to red states, they are suffering in the same ways that we all are suffering in terms of job loss and economic uncertainty on top of the pandemic. Cases are surging in many of those states. So I am optimistic that Congress is going to get more cash into Americans' hands because it's common sense. How are tens of millions of Americans going to get by if many of them can't go to their jobs? And it's bipartisan. So millions of Americans got the $1,200 stimulus in April, and it was a massive relief. We should be heading in that direction because the biggest problem with that $1,200 payment was that it just happened once. Um, Households breathed a sigh of relief, but then thought, okay, what am I going to do next month and the month after that? So I am optimistic that Congress will do the right thing and pass cash relief very, very soon. Hopefully, it'll be ongoing and repeated instead of just another one-time payment.
We spent some time on the trail together last year, and I want to harken back to that. You spoke a lot on the trail about automation and your fears for the future surrounding that. The current pandemic has a lot of people and a lot of working from home, or a lot of businesses adjusting operations because of the current crisis. How do you think the economic data from now bodes for our future jobs market?
Unfortunately, the concerns I had have been accelerated through this pandemic, where we're seeing 10 years worth of change in 10 weeks. And many of the people that are being kicked out of the job market right now are the people that have the least amount of savings or skills or flexibility to make a meaningful adjustment. Some of us are lucky that we can work remotely. But if you think about all of the security guards and nail salon workers and ushers and servers and bartenders, I mean, like for them, their job market is going to be depressed not just for weeks but for months and even years. So we need to think much bigger about how we're going to reform our economy to work for people that are going to not have any place in our job market in the coming days. One of the things I'm pushing Joe on really is that we need a Relaunch America plan, where it's like a New Deal or a Marshall Plan for the country. Because instead of saying, oh, if we can just get back to normal, we're going to get through this, we have to accept the fact that normal has changed forever. And if you think about your own experiences, unfortunately, we're all more excited about interacting with companies that don't have humans involved anymore, because the human is a potential risk factor. So if you had your pizza delivered by a Domino's self-driving car, instead of saying, wow, that's a little bit creepy, you're like, oh, good, I didn't have to interact with a person. Companies are doubling down in their investments in automation and doing more with fewer workers. You're seeing it too in the stock market prices, where these stock prices go up when they announce layoffs. And that's happening, unfortunately, all throughout the economy.
Has former Vice President Biden been open to those proposals that you have been floating his way?
And when I've talked to Joe, he agrees that we need to think bigger about how we're going to make the economy work for more people. He understands the severity of the crisis that we're in, and he's very open-minded and pragmatic. Now, have I gotten him to commit to, a certain amount of money per month or something like that? No, but have I had conversations with him that make me very, very excited about the fact that we're going to be thinking bigger? Yes, I have.
I also wanted to ask about Martha McSally. She's a Republican from Arizona who is in a competitive Senate race right now for re-election. She introduced a bill that would give individuals and families a tax credit for travel, and I noticed that you retweeted some information about this. Are you supportive of that proposal?
I think it's a terrible idea to encourage travel during a pandemic, and I'd prefer cash to a tax credit. I retweeted it saying that this would be great if it was a staycation, where we should be paying people to stay home, not to travel. But I liked the fact that a Republican senator was suggesting getting more economic resources into people's hands, because that's really what we should be doing more and more of right now.
Switching tracks a little bit, because you were the tech candidate. There are a lot of companies right now, like the North Face and Patagonia, that have made headlines for boycotting Facebook over content moderation. My question for you is whether you think this is a Band-Aid or a permanent solution.
I think that the fact that we're having this conversation speaks to how Facebook has been failing in its responsibility to Americans and consumers by refusing to take any responsibility for the kind of content it publishes. And I use the word publish very specifically because their stance has been, we are not a publisher, which if you look at it, you have to say that's ridiculous. They're the biggest media company in the world at this point, and they should take the same type of responsibility that Time or cable networks take, where if they repeat a political ad, they verify that it's true, and that they should have some standards and have the resources put in place where they can make judgments and determinations and then stand behind them. Saying we can't figure it out for a company of Facebook's wealth and expertise is just a giant cop out. And so the fact that there are advertisers who are trying to hold Facebook's feet to the fire because so many people are angry about Facebook's stance on this, to me it's something that is showing just how out of step Facebook's refusal to take responsibility is.
And I do have a question about your future. When are you announcing that you're running for mayor of New York City?
Well, thank you for the question. My focus is on helping Joe win right now and on helping our country get out of the deepest, darkest hole we've been in our lifetimes. 72% of Americans say right now is the darkest time in American history that they can remember. And we need to start digging our way out. We need to relaunch America. So that's where my focus is right now. But I will say it's incredibly gratifying to be thought of as someone who could help New York City turn around as well. I love New York City. Lived there for a long time, have very deep roots there. And I'm going to do everything I can to help New York City. But right now, to me, the biggest problems face the entire country. And we need to help Joe win and then start trying to figure out how to solve some of these problems.
I do have a question for you about Biden, but before I ask it, I want to ask one follow-up question, which is, are there any other offices that you're considering? And if so, which ones?
I'm naturally attracted more to executive type roles. I've been a CEO and I like to get things done. So those are roles that I'm drawn to. So that would be mayor, governor, president, obviously, which I ran for, and came up short. But those are the kinds of roles I'm naturally attracted to. There could be cabinet roles that also resemble that, and that I'm very passionate about the fact that we need to get our federal government caught up to technology issues where they're decades behind the curve. And some of these issues are having disastrous effects on our democracy, on our kids' mental health. So I recently launched an initiative around the use of our data. And if you look up, we're all clicking, I agree, I consent, when we get those privacy agreements from Facebook and the other companies. And now our data is being sold and resold for tens of billions of dollars a year. We're not seeing a dime of it. And it's corruptive to our democracy itself. So these are some of the issues that I'd love to help us address. And if I had a chance to do so in a Biden administration, I would be really excited to look at it.
Have you had conversations with presumptive Democratic nominee Biden over possibly joining his cabinet?
Oh, we've had general conversations about the fact that Joe would like me to play a role and be helpful, yes.
Care to expand at all?
Just that I'm driven to help Joe win, and I think that we're going to need all hands on deck to help clean up the historic crises that we're in the midst of. So that's a pretty political answer. It sounds terrible. I'm sorry. I apologize for sounding like a politician. This is awful. What has happened to Andrew Yang?
You spent some
He used to
time on
talk like a human being. That's what happened to me, Lisa. It's true. You saw it. You saw it's like, wait a minute. That's not the Andrew Yang I remember from 2018 or whatever it was.
So I do want to ask you a little bit about this data dividend project that you just alluded to. As I understand it, you're basically seeking to unionize internet users and negotiate how much they're paid for their data. What is the underlying problem you think that this would fix?
We're taking advantage of the fact that California and Nevada have passed laws that give internet users the right to know what happens to our data, the right to opt out, the right to delete. And right now, tech companies are falling short on all of those fronts. And so the average consumer is completely in the dark as to what the heck to do. The average consumer is just clicking I agree and hoping for the best, and then hoping nothing that terrible happens. So our goal is to activate consumers around their legal rights under these laws in California and Nevada, have those laws adopted nationwide. Because if you're in New York, you'll look up and say, wait a minute, people in California have rights to their data and I don't. And then you go to Albany and say, maybe you should just write that law. And I'm happy to say that New York is looking at emulating the California law. Washington is looking at emulating the California law. And so the goal is to activate the people around our data rights, get us paid for some of that value, because again, Facebook alone is profiting to the tune of tens of billions of dollars a year off our data, and push better policies across the finish line, whether that's different states adopting a version of the CCPA, which is the California Consumer Privacy Act, or federal legislation. But I'm not the type to wait around and wait for legislatures to do the right thing, particularly when there are laws in the books that will enable us to help consumers right now get at least some proportion of that tens of billions of dollars that's being made off of our data every single year.
That's a great place to end things. Thank you so much for your time today and for taking the time to speak with us.
Like a good neighbor, State Farm is there.
Welcome back. Next in our program, we'll be joined by Katie Couric, who as part of her Time Reports series will be speaking with Ruby Bridges about her memories of being the first Black child to desegregate the all-white William Frantz Elementary School in New Orleans in 1960, and why the current protests give her hope.
I felt so saddened when I actually witnessed this murder happen right before my eyes. And I could only think about the kids watching and what they must have been thinking. The fact that it has been happening over and over and over again, I believe that it was just the straw that broke the backs of so many people before that young man. To see the young people take to the streets, I felt like it was about time. It made me think about the protesters from 1916. It made me think about the day that I walked up those stairs when I integrated Frantz School.
As a 6-year-old girl integrating William Frantz Elementary, do you remember much from that day, Ruby?
I definitely remember that day. You know, even though I had already gone to an all-Black school for kindergarten, I knew what school was like. At least I thought I knew what to expect. But, you know, now I was going to switch schools and go to my neighborhood school, which happened to be a white school. But my parents never explained that to me. And when I arrived and I saw the crowd of protesters, you know, living here in New Orleans and being accustomed to Mardi Gras, that's exactly what it looked like. I thought we had stumbled into a Mardi Gras parade. What I remember the most as a child was that the crowd would come and they would bring a small baby's coffin, and they put this Black doll inside of the coffin, and they would march around the school, and I would have to pass it to get inside of the building. And I used to have nightmares about the coffin. That was my first encounter knowingly about racism. I realized at that point, it's not Mardi Gras. It all came together and it made sense then. I knew that it was about me, and I knew that it was about the color of my skin.
How did you feel, Ruby, when President Obama put that Norman Rockwell painting, The Problem We All Live With, in front of the Oval Office?
I was so proud of that moment because it was the 50th anniversary of my walk into the school. When I got the phone call to come and see it, I cannot even begin to tell you how moved I was. I remember when I went in to meet him, they were explaining how I should greet him when he came into the room. And so I did exactly what they said. I extended my hand and I said, "Mr. President, it's an honor to meet you." And he put his hands on his hips. He looked at me and he said, "I want a hug." And he just wrapped his arms around me and he whispered in my ear, "I cannot begin to tell you how honored I am to invite you into this White House." When I looked around the room as I was leaning over his shoulders, there were only about a dozen people in the room. They all started to cry. And at that moment, I understood what that meant. It wasn't he and I meeting. It was history. It was those two generations coming together. Everything that all those people fought for. I think if we look at the protests that are in the street and has spread across the country, those protesters look very different from the protesters during the civil rights movement. Yes, there were lots of white folks, Hispanics, lots of people that took part during the civil rights movement. But what we see today in the streets is very, very powerful. And I believe that that is because of what Dr. King was struggling for and so many others, both Black and white, those rights that we were experiencing and taking advantage of. That is what I am so hopeful about. They've taken on this charge, and I think the baton has been passed. You know, I always say that my point of view actually comes from the point of view of a child, because that's my legacy. And again, I say that if we're going to get past our racial differences, it's really going to come from our kids. I want to get the kids before that's been passed on to them. None of our babies come into the world knowing anything about disliking someone because of the color of their skin. Our babies, no matter who we are, they come into the world with a very special gift, and that is a clean heart. For 25 years, I've been working with kids in schools all across this country. When I looked into their eyes, I didn't see hatred or racism. I saw hope. I knew that they too were exactly like me, that they still had that innocence that they came into the world with. And I thought it was important to help them to understand that racism has no place in their minds and in their hearts. And know, really, that we're all human, and that, you know, what Dr. King stood for is that you should never look at a person and judge them by the color of their skin, but by the content of their character. And I think what we see in the streets today speaks to that. I was always hopeful, and I am hopeful today, because what I see is that this is spread across the country. And I think when we open our doors and we are able to go back out, this world is going to be a different place.
Thank you, Katie, and thanks for being with us, Ruby Bridges. Next, we'll join Time Senior Health Correspondent Alice Park. Alice will be speaking with the Director of the CDC, Dr. Robert Redfield, about America's response to COVID-19, the recent resurgence, and what's ahead.
I'm Alice Park, Senior Health Correspondent for Time, and it's my pleasure to welcome Dr. Robert Redfield, Director of the U.S. Centers for Disease Control and Prevention, which we all know as the CDC. Dr. Redfield, thank you for joining us for this Time 100 Talks.
Thank you, Alice. Glad to be here.
We're seeing states all over the country now start to reopen. What, in your mind, are the most important criteria that these states need to consider as they start reopening and as we have people now mingling back together after being in this period of lockdown?
Well, when we originally put out the guidance for reopening America again, there were several features that we believe were really important. The first was 14 consecutive days of decreased cases in the community, in the jurisdiction. The second was a 14-day progressive decrease in the percentage of tests that are done that were positive for COVID. The third was to have adequate testing capacity for readily available testing, and then to be building the contact tracing ability so that they could have effective contact tracing. These core elements of early diagnosis, isolation, contact tracing, really critical to have them in place. The other aspect of it is the continued embracement of the social mitigation strategies that we have really recognized as our key weapons against this virus right now. That is 6 feet distancing, wearing face coverings, good hand hygiene, obviously staying home if you're sick. The big challenge, as you know, Alice, is that this viral infection can actually cause substantial infection without any symptoms at all. And a significant number of individuals that may be infected may not have symptoms, maybe as from 20 to as high as 80% of individuals could be asymptomatic. So these social mitigation strategies are also important, together with the decreased number of cases, decreased percent positive, making sure that they have testing capacity, make sure they have hospital resilience, and they make sure that they're building their contact tracing capacity.
And even with these guidelines, in terms of the number of cases, we are now at the same level where we were at the peak of the pandemic about a month and a half ago. And in some states that have reopened, Texas, Florida, Arizona, for example, we're seeing that resurgence along with an uptick in hospitalizations, which means that it's just not that we're picking up more cases with testing. Does that tell you that these states reopen too soon?
Well, Alice, I think we always expected to see cases to increase as we reopened. Clearly, the mitigation that the American public engaged in March, April, May, really congratulate the American public. I think we did protect a lot of vulnerable people because of the aggressive mitigation that we did. So as we reopened, we expect to see more cases. We'd like to see those cases early identified and contact trace and isolated around them so that we can prevent sustained community spread. And, you know, that is the big challenge. As you mentioned, currently we have an increased number of cases. We have, I think, even 11 states that have increased hospitalizations right now. We continue to see the net consequences of this outbreak decrease. That is, in terms of mortality. I think the last 2 weeks average mortality rate was we had around 650 individuals. So that's continuing to come down. That's an important advance in that consequence. And obviously the other consequence is reopening the economy and letting individuals begin to get back to work and their employment. So we continue to deploy CDC rapid response teams to the different health departments that are seeing these increased cases. They're not really statewide. And it's a little misleading sometimes when we see the big maps that are all filled in with different colors. It's better to look at it at the jurisdiction level, at the individual county level. But we do have, over 100 counties right now that we consider hotspots. To put that in perspective, that's about 3% of the counties in America are experiencing higher transmission rates than we would like to see. And we're putting public health teams into those jurisdictions, supporting the state, local, tribal, territorial health departments to try to understand what's the source of that community spread? Is it an outbreak? And how to basically contain it. I might comment that, recently we saw, for example, Alabama and North Carolina have significant increases. We launched teams to go in and work alongside with the local health departments. And both of those states now are back down. So I think we're going to continue to see this, where there'll be individual jurisdictions that are going to increase. That's going to make an impact on the reporting from that area. And then we need to go in and try to find root causes and bring those that community transmission under control.
And the CDC, one of its roles is to advise state and local health departments. Would you advise them to impose travel restrictions between states, for example, where cases are rising, to really prevent kind of a nationwide resurgence in coming months?
You know, Alice, each state's going to have to make their own decisions. Personally, I'm not one that feels that's going to be an effective strategy for us right now. I am one to really stress the social distancing that I just discussed, of wearing face coverings, hand washing, etc. I did notice today that a number of states have decided to put more restrictions. We did it when the outbreak was really out of control in New York. We recommended that individuals coming out of New York stay self-quarantine. So I think it's an individual decision by the states, and I respect their public health decisions.
Okay. You've said before that you're worried about the combination of flu and COVID-19 in the fall and winter. And recently you testified to Congress that Americans should get their flu shot because next season's influenza illness will occur simultaneously, potentially, with COVID-19. What does the latest science show us about how influenza and COVID-19 could possibly interact, and what should we expect?
Thank you, Alice. I think this is one of the most important things we can do to prepare for the fall and winter that we're going to experience. And the real risk is that we're going to have two circulating respiratory pathogens at the same time. We know flu by itself can cause substantial morbidity, mortality, and hospital utilization in our nation. In some jurisdictions, flu itself can bring hospitals into great stress situations. And then you combine that with the recurrence of or the continuation and expansion of COVID-19 during the fall and winter. This could be really a very, very difficult situation. This is one of the reasons I've really asked the American public to really embrace flu vaccination with confidence. This single act is going to save lives. As we sit here, historically, less than half of the American people get flu vaccine. Many people don't realize that flu can cause substantial mortality. More than 360,000 people died from flu in the last decade. So we have a vaccine that can prevent death and illness and infection in influenza. And as I said, with less than 50% of people accepting the vaccine, this is a year that I'm asking the American public to seriously reconsider, because that decision may make available a hospital bed for somebody else that really needs it for COVID. So I think it's really important. We're hoping that we're going to be able to get significant more of the American public to embrace it. Clearly, these two viruses are very capable of causing significant morbidity and mortality, particularly in those who are elderly and have underlying medical conditions.
You've emphasized the importance of testing to ensure that we keep a handle on this pandemic, especially as people start emerging from isolation. But just a few days ago, the Trump administration officials reported that they were going to pull federal funding for testing sites across the country, including in Texas, where we're seeing an uptick in cases. Have you, and will you speak to the president to reiterate the importance of testing?
Testing is really a critical component, as I said, readily available with timely results, so those results are actionable. The decisions on the testing sites that you mentioned, there were 13 of them that were transitioned into our community health centers. The remainder ones that were discussed potentially of closing, they're going to remain open at least for the next 60 days. So testing is a fundamental requirement. We at CDC are also going to be expanding testing for what we call surveillance, because so many people are asymptomatically infected. The only way we know that if the virus is in some different communities is if we actually do proactive surveillance. Congress has provided to CDC substantial resources, of which $10.25 billion, $10.25 billion were made available for CDC to give to the states to build their testing strategies, contact tracing strategies, isolation strategies. CDC has already given those resources to the states. The states have developed plans which have been reviewed, at least for the month of June and July. And then in July 15th, their plans for the rest of the year. Getting those new resources to the states to make sure they have robust testing is fundamental to our ability to stay ahead of this outbreak. So this is not a time to decrease testing. We have made enormous improvements in the availability of testing, but we still have a ways to go till we get to the testing availability that I believe will be necessary to have us stay ahead of this outbreak in the fall and the winter.
And do you feel any pushback to that? I think, all public health leaders agree that testing is going to be crucial, as we go into the fall. But has there been any political pushback to being able to keep that network and keep those programs going?
No, I think the truth is, I think that there continues to be high interest in us continuing to expand. I think as of today, the United States tested, I think, 29,300,000 individuals. As I mentioned, we're now testing 500, 600,000 a day. But I don't want to stop there. I think we still need expanded testing readily available throughout each jurisdiction in this country. It is going to be the underpinning of our response, coupled with, as I mentioned, the contact tracing. It's worth to take a minute on contact tracing. In January, our nation had about 6,000 contact tracers in the health departments across this nation. As of June 2nd, it was reported now that's up to almost 28,000. I've estimated that we're going to need close to 100,000. My predecessor, Tom Friedman's, estimated it might be as high as 300,000. But we are going to continue to work with the states in the month of June and July to get those contact tracers up really in the range of, they estimate they need about 78,000 when we've polled them all. But we're going to need to get it up to that range of between 80 and 100,000 at least to be prepared. But that in itself isn't going to help us if we don't have readily available, expansive testing.
And some of your predecessors, former heads of the CDC, have used words such as greatly concerned and surprised that the CDC just isn't more visible in informing the public about the changing situation with COVID-19. And some leaders have even suggested that the CDC has been sidelined during this pandemic. For example, the White House held up your agency's proposal for how to reopen America. Has the CDC been sidelined when it would normally be taking a more visible role in guiding the country through this pandemic?
Alice, I'd say no. A couple things I would say. First, we have a seat at the table in the task force where I represent CDC for many, many, many months. It was every single day, 7 days a week. Now the task force meets several times a week. So we're representing our views. And I can tell you those views are heard and those views are respected. Secondly, we've reached out to the American public. We've put out more than 1,500 guidance documents and consideration documents from CDC. We continue to post them regularly. We've had over 1.5 billion hits on our website to download those documents and read those documents. We have conferences with the state, local, tribal, territorial health departments multiple times during the week. We're having interactions at that level. We're having interactions with special communities, whether it's faith, business, school, higher education, to share our guidance directly with them. So we continue to be quite visible, I think, at the local, state, and local territorial level. And we will continue to try to expand our opportunity to communicate more directly to the media and the leaders like yourself to get the words out more directly as we get those opportunities.
Okay. And you mentioned the White House Coronavirus Task Force, and the White House recently released its list of 5 vaccine candidates that would be part of Operation Warp Speed. You know, that would mean they would receive funding and support to continue their development. Were you part of the discussions on the selection of those 5 candidates?
Yes, I'm on the board of Operation Warp Speed. So we're one of the members of the board.
And do you feel the scientific perspective was there pretty much consensus agreement on those 5 candidates that were selected?
I think there were excellent criteria that was developed, because one of the major criteria for consideration of all the different candidates that were looked at was there the capability of actually manufacturing that vaccine and having it available by the end of 2020, beginning of 2021. So of the initial 5 candidates that have been selected for acceleration, and when we talk about warp speed, the speed is not to take any shortcuts with safety of the vaccine or even the scientific integrity of the process. The speed is really around taking financial risk. Normally, when we develop a vaccine, you do a phase 1 trial. If it looks good, you do a phase 2 trial. If it looks good, you do a phase 3 trial. If that trial shows efficacy, you may or may not have to do another phase 3 trial. Then when you have evidence that you have efficacy and the FDA recommends approval, then you go figure out how to make enough to give to people. What we're doing in this situation is, as these vaccines go into phase 3, and we should have several vaccines into phase 3 trial before the end of July, that the commitment will be made to manufacture that vaccine in order to have at least 100 million doses, so that if it works, we have the vaccine at that moment in time. I want the American public to realize Tony Fauci and I aren't big fans of the word warp speed, because people think we're skipping steps. We're not skipping steps. The only real risk here is financial. So the candidates that were selected were the ones that had the best evidence from preclinical data and had the capability of actually being able to meet the manufacturing goal of being available by January 2021. There's additional candidates that will come along behind it that may be available later in 2021 and 2022. But these candidates were also selected for the mission, which was to have vaccines available for the American public by January 2021.
And from what you've seen, since you were on the board and sort of looked at the data that the companies have so far in their plan moving forward, how realistic is it that we can expect a vaccine, toward the end of this year, beginning of next year?
Well, I think if you'd asked me that question 12 weeks ago, I would say it was highly optimistic. If you ask me that question now, I think there's a real probability that we're going to accomplish that. No one can guarantee it, but the amount of progress that's been made in recent weeks is substantial. So I think if you were to ask most of us, myself, Tony, and others, I think right now we think this is a realistic goal, and I think we really do have a real good chance of having a vaccine available, one or more vaccines available before January 20.
Okay, and finally, just wanted to ask you, looking back with 2020 hindsight, was there anything you would have done differently in terms of handling the pandemic toward the beginning of the year, January, as the cases were starting to appear here in the U.S.?
Alice, it's an important question, and I think we're going to have, lots of reflections when we get through this and get this pandemic behind us, which I'm confident we will. I think the first thing that I think I wish had been different, whether I could have made it different or others could have, I wish that the American CDC was invited in to work alongside my Chinese colleagues when I asked on January 3rd to send teams in to assist them. and formally wrote a letter on January 6th asking my colleagues, who I have a lot of respect for, to allow CDC to send individuals in to help. Because if we had done that, I think we would have learned more quickly that the initial assumption that this wasn't transmitted human to human was obviously not correct. It is transmitted to human to human. The second thing that I think we would have learned quicker is not only is it transmitted human to human, but it can be asymptomatic and asymptomatically transmitted human to human. I think those two scientific understandings, because when we were looking at this initially, it was thought by our Chinese colleagues that this was not transmitted human to human, it was animal to human, and there weren't secondary cases. And it was taught that it was a symptomatic illness, and we didn't understand the scope. So those scientific realities I would have really loved to had a handle on. The other area that I think I would have, if I had 2020 hindsight, is I think it would have been useful if we'd gotten the private sector engaged earlier in January to help with the diagnostics. Clearly, CDC did its job. I think we've gotten unfairly criticized because people didn't realize what our job was. Our job was to develop a test for the public health laboratories in this country, which we did, and we did it in record time. And that test was always available, was never flawed. When CDC decided to further manufacture that test, to give that test to be able, each lab to do it itself across the country, we had a manufacturing contamination, which we had to take the next 3 to 5 weeks to figure out and replace. If I did it again, we would have a manufacturer manufacture the kit. But most importantly, I would have gotten the private sector involved to be making test kits for the hospital and for clinical medicine. And the private sector stayed on the sidelines because they developed these tests for SARS and no one needed to use them. Then they developed them for MERS and no one needed to do them. So I think if I had a do-over, I would get the private sector making these tests back in January at the same time CDC was making the public health tests. So we would have had expanded availability of the private sector to provide testing. Those are probably a couple of the things that I think would have had an enormous impact, particularly getting the scientific information. If CDC and WHO had been invited into China, the first week of January, I think the world would have had a better understanding of this pandemic going into February, and we could have put that knowledge into action.
I just wanted to go back to that then. My understanding is, so CDC does have a team, right, in China that's permanently based there and works regularly with scientists and health officials in that country, right? So it's a matter of being invited by the Ministry of Health and researchers there to participate yes. and sort of, I guess, share the research that's available, right?
That's right. CDC has people in about 60 countries around the world, including China. And we've had a long positive relationship with our Chinese colleagues. And I actually have a U.S.-China CDC co-located with the China CDC, the Chinese CDC. And we work together on flu and respiratory viruses and a variety of diseases. Our footprint has been smaller as funding was curtailed in several years ago. But now, in the last year and a half, I've been augmenting that footprint because I think it's really important to maintain that. When it came to this particular outbreak, there was not our American CDC in China, they were not brought in to work with the Chinese CDC on this outbreak. And I wanted to augment.
Why was that? Was that unusual to not be invited?
Yeah, I think it was unusual. It was not a decision made by the Chinese CDC, and I had rostered a number of individuals that were prepared to go assist. I assumed when I talked to my counterpart in China on January 3rd, I assumed that we were going to be invited to put our teams in because we've never been not invited. And so I had rostered teams ready to go of experts to go assist. And unfortunately, we were not invited. And even when the WHO brought their team in, which was very restricted, the United States only got 2 individuals on that team, and CDC only got 1 individual on that team. But we were prepared to put 20, 30 people into the country to really help get a handle on this outbreak right away. And, I'm confident it wasn't a decision made at my counterparts level. And I don't know why China decided not to take advantage of the help that we offered. But we will continue to offer that help, and we will continue to try to build our partnership with China in our China CDC, as we will with the other countries around the world where I have full-time people deployed to work in partnership with the local health departments in those nations.
And how is the collaboration with the Chinese scientists and Chinese CDC now between the U.S. CDC and the China CDC?
I think it's good. We continue to work on some very important areas. As I say, we've had a long history of working together on influenza and some influenza surveillance. So we have a long history of working on emerging pathogens. I have a country director there, and scientists come join that team full time to live in China, and so we're augmenting our China footprint as we speak.
Dr. Redfield, thank you so much for joining us. We really appreciate your time, and thank you for your work and the work of the CDC in guiding the country through this pandemic.
Well, thank you too. I appreciate it. God bless.
Thank you, Alice, and thank you, Dr. Redfield. In just a moment, we have a piece on Kimberly Jones and Geely Siegel, co-authors of the 2019 young adult novel, I'm Not Dying With You Tonight, about race in America. You might recognize Jones from her impassioned video that went viral earlier this month, in which she addresses the systemic financial oppression faced by communities of color. Their discussion is about the problems with the way children are taught American history, how they manage uncomfortable conversations, and much more. But before we do that, I wanted to share a short conversation with chef, restaurateur, and Food Network host Guy Fieri. We spoke with him recently about his efforts to help restaurant workers through the pandemic and his thoughts about how restaurants can approach the reopening that's happening around the world.
Listen, when this all went down, the first thing I was thinking about is how can I help? I started sending videos, personal videos, to each one of the CEOs of the major companies that had something to do or some involvement with the restaurant industry. I think I sent 43 of them out total, and just said, here's the deal. Restaurant industry's been hit like it's never been hit before since the Great Depression. Tens of thousands of restaurants out of business, millions of employees without jobs. Restaurant industry's been great to you. Let's be great to the restaurant industry. Let's help them out. Next day, Pepsi gave us $1 million.
Guy Fieri is helping restaurant workers during this pandemic. He's raised $20 million in donations. Back in March, Fieri launched the Restaurant Employee Relief Fund.
I grew up in restaurants. I've been doing restaurants my whole life. Had my own restaurants, had my own small mom and pop restaurants, have big restaurants now. But once you're in this business and you know what is in this business, you are part of the family, if you like it or not. Why did I support the restaurant employee? I know that a lot of the employees live paycheck to paycheck and work multiple jobs in the restaurant industry. A lot of them are single parents, college students. A lot of the jobs are their second job. So they're really a key niche group of people, and they really needed support. These restaurants are really such a major part of our community. They're really kind of like the fabric. We're going to lose restaurants, unfortunately. That is the case. We're going to lose a lot of jobs. But one great thing about the restaurant industry is we adapt and overcome. I know it's frustrating. I know it's difficult. But as we have with so many other tough situations in our history, we've stuck together and we've persevered and we've supported one another. And it's made us a better country because of it.
And we've upgraded her with a sonic shield.
Impressive.
There is one more thing.
Huh. Jake from State Farm.
Here's the deal. With the Drive Safe and Save app, you'll also get rewarded for being a safe driver. Like a good neighbor, State Farm is there.
we have to get proactive and not do passive work anymore, do aggressive work, especially because we have brilliant tools that allow us to do it.
How can you win? How can you win?
Imagine if Martin Luther King had a Facebook, like the way in which, information could have been sent out.
You can't win. The game is fixed.
I thought, I can't wait for everybody to see this video. I've been working with Kim for 5 years. She has this tremendous capacity to encapsulate difficult things in understandable ways.
If I right now decided that I wanted to play Monopoly with you, and for 400 rounds of playing Monopoly, I didn't allow you to have any money, I didn't allow you to have anything on the board.
People have asked me like, oh, was that like a pre-written speech? Did you know you were gonna do that? And I was like, no, that was just me being tired and exhausted and upset.
As far as I'm concerned, they could burn this to the ground, and it still wouldn't be enough. And they are lucky that what Black people are looking for is equality and not revenge.
It was super surprising to see the outpouring of support for it and the amount of, tastemakers and celebrities who were reposting and commenting on it. And I honestly couldn't even keep up with it all. Geely would email me and be like, oh my God, it's on Madonna's page.
I would never have told this story by myself. I don't have the lived experience to do the story of a young Black woman in a moment of civil unrest on my own.
So she had her bulleted list of how she was gonna convince me to write this book with her. And I was like, you had me at let's write together. Geely and I have difficult and uncomfortable conversations all the time. It's just the nature of what's gonna happen when you have a Black person and a white person writing books about race in America. So we created a safe word. It basically meant when I say this word, I am about to ask something that I'm super uncomfortable asking, or I'm about to say something that may be deemed ignorant. But we both knew going into this process that neither of us would ever intentionally do anything to harm each other.
Yeah, and as an author, it's important to think about how the way that we teach history, which especially at young ages is a series of stories that we're telling our children, who are the heroes and who are the villains? And that includes telling honest truths about the times when white people have oppressed the Black community, the Indigenous people, and others.
You broke the contract when you killed us in the streets and didn't give up. You broke the contract when for 400 years we played your game and built your wealth. You broke the contract when we built your wealth.
The overwhelming response has been positive and have been people saying, oh my God, there's so much information in here in 6 minutes that I never learned in years of, going to school. And now I'm educating myself and my children.
This conversation has to start at home, in part because my kids are white. Kim doesn't have the luxury of not preparing her Black son for the world that we live in. And I shouldn't have the luxury of pretending that racism and privilege don't exist in my own home. And it's hard, but if we don't talk to them about it, how could we ever possibly hope that anything is going to change?
A lot of what's happening with systemic racism is rooted in the economics of the country, and slavery was an economic decision. Part of where we're going to need to begin to, fix the problem is allowing wealth to circulate in the Black community. I mean, people don't even know things like Brooks Brothers suits made all of their original money dressing slaves. And so now you look at a descendant of Brooks Brothers who's still sitting on that board, is still benefiting from money that was earned during slavery. So when you're talking about people who were able to build this wealth that they've been able to pass down generationally, and this financial knowledge that they've been able to pass down generationally, you have to talk about those slaves who the debt was built generationally and the lack of knowledge about finances. And so to say that, oh, that happened all those years ago is not affecting us, but it is still affecting us today. And then you look at a situation like Tulsa, Oklahoma. Tulsa was known as Black Wall Street because it was a thriving financial community. And then they destroyed an entire town of people for doing nothing other than thriving. This is not taught in the history books. So people don't know the intentional devastation of the circulation of the Black dollar. And then there's this conversation and this narrative of why can't you just pull yourself up by your bootstraps? And it's this is comical to me.
People are like, well, what did you gain? Well, what did you get from looting? I think that as long as we're focusing on the what, we're not focusing on the why.
it's really easy to dismiss why people could be so far to this state that you would have rioters and looters. And that's not that I'm anti-peaceful protest, because I'm not. But my point is, Colin Kaepernick was a peaceful protest and nobody was a fan of that. And so this idea that we're consistently being asked to protest in a way that is acceptable to the people we deem our oppressors is kind of a ridiculous notion to me.
When we're hearing painful truths about systemic injustice and racism, sometimes, among the best intentioned white people, there's this knee-jerk reaction of not me, and we seek that pat on the back and that reassurance of I'm one of the good ones, right? But systemic injustice and racism exist along a spectrum, and we all participate in and benefit from this system. And so whether it's your family, whether it's your corporation, your faith community, we have the ability to begin incorporating change in the way that we talk and interact with those communities. But if we don't think that we're part of the problem, we're never going to start. There's more work to be done, and we anoint ourselves with the badge of ally, or like the badge of wokeness. But being an ally, it's not a destination that you arrive at. It's a journey that you're on, and you're going to get things wrong. I get things wrong. I will forever. In those moments, my job is not to defend myself, but to take a step back and say, how do I learn from this, and how do I go forward? When we know better, we do better.
This is probably the largest global protest that I've seen in my generation. My only hope is that after everyone's gone back inside and the protests have ended, what are we going to do for next steps and how people are going to participate in that? But I'll take this victory right now of people giving up their silence, because that has been a big first step.
Coming up next, Time's Dan Maxey, Executive Editor, Editorial Director of the Time 100. Dan will be speaking with singer-songwriter Jordin Sparks about her commitment to supporting social causes and the role of artists in this moment.
Hi, I'm Dan Maxey, Executive Editor at Time and Editorial Director of the Time 100. I'm so excited to be joined today by American Idol winner and multi-platinum recording artist Jordin Sparks. Jordin, thank you so much for taking the time to chat with us.
Of course, thank you so much for having me.
So you've been in this industry a long time. In fact, I think the first time we spoke was back in 2012 when you were promoting Sparkle. So it's great to see you again.
So crazy.
I know.
It seems so long ago.
I know.
So long ago. And I guess it was when I really think about it, but that's just nuts. Time is flying. It is flying.
Yeah. Yes, for me too. But as you put it recently, and I want to talk about this, no matter your career accomplishments, you've been nervous to speak out about particular causes until now. So I'm wondering, what is it about this moment, about the protests happening in the wake of the killing of George Floyd that has changed things for you?
It's interesting because I know that I've been getting this question a lot since I actually mentioned it, and I am one of those people who never likes to be misunderstood or for my intention to be misunderstood. And I never want people to feel offended or to feel like I'm saying something that would be malicious. I would never do that, And for a very long time, whenever I would think about politics or anything like that, I would just be like, I hate the way people treat each other when we talk about politics. I don't like the fact that everybody gets so riled up. Granted, there are really not amazing, but there are very valid reasons why people get so riled up and why people get so angry, and they want to voice their concerns. And for me, I was sitting with my husband. We've always had really amazingly deep conversations, and I've always felt this way. I've never posted about it because I just didn't know what to say. I didn't know what to say. I didn't know how to word it. I didn't know if what I felt was going to come across in the right way. But as Dana and I were speaking after the murder of George Floyd and going through the emotions that we felt with that, and it's different now because the fear is very real when Dana leaves the house. When my husband leaves the house, it's like, okay, hopefully things are good, and you know, are all of our tags and our plates are good, like are we okay? I don't want him to get pulled over. That fear is very real, and it's very real for a lot of families across America. And I also have to look at my son as well. DJ, he has blue eyes and he's lighter, but he's still a Black kid. He's still going to be viewed as a Black kid. And I am realizing that there, as much as people think he's adorable and they think he's so cute, at some point when he gets older, there are people who are going to view him as a threat for whatever reason. It's just going to turn into something like that. And I realized that if that was my husband, if that was DJ, if it was my dad, if it was my brother, it could have been. It could have been. And it's just at the point for me where I'm just like, if I offend, if somebody gets angry, all right, we all have a right to feel that the way that we want to feel. And right now, and through the end of time, I don't care. I have to talk about this and I have to speak about it. And for me, it's been very, it's been great to finally do that. Right. I had been holding my own self back in that regard of saying what I really felt and really speaking my mind. And I just, it's time.
Yep.
It has been past time for me to say something. And I have to step up and take accountability and be accountable to myself and to my family and to my son, because I'm hoping one day he won't have to have the conversation with his kids about how to conduct themselves outside of the home. That's a conversation that we shouldn't have to be having with kids. Kids are innocent. We should not have to be having that conversation. But right now in this nation, it is very real that we have to say these things to our children. And I'm grateful for my husband and his patience and him challenging me and him, having so many conversations with me, because even though I am also a Black woman, I grew up completely different than my husband did, and I have different experiences than he did.
And I know, in addition to speaking out and clearly listening and using your platforms in the way that you have, you also attended a protest recently. And I'm curious, what was that experience like for you? And was there anything that stood out?
I did post about this experience on my Instagram page a couple weeks ago, but we did attend a protest. With DJ, we still have to be careful. COVID is still happening, so we have to be as careful as we can. Yeah. But my husband and I were it just got to the point where we were sitting, and I've always wanted to go. Mm-hmm. For one reason or another, I haven't been able to attend, but we finally were just sitting, and it was almost like we just got this antsiness, like we have to go. We have to be out there. We have to be out there and be supporting. And so we went. It was down the street, Hollywood and Vine, and our experience was a good experience. We did see the police standing in the line. We got out, joined another group of people walking to the bigger group, and as we were walking, there were police cars that kind of rushed by us, and then we finally saw what had happened. They were standing and they blocked us from walking any further. And it was really interesting because we were just walking. Like nobody was doing anything. Everybody was we were all peaceful. Nobody was saying anything crazy. And they wouldn't let us walk, and they were ready. They had their tear gas guns out, and their shields on, and I was standing a couple of feet back because I didn't want, just in case something happened, I wanted to make sure that my husband and I were out of range. And so we were standing there, and we started chanting, "Walk with us," and let us through, and they wouldn't. And so Dana and I were like, okay, let's wait a few minutes and see what happens. And then we're like, let's turn around. So we started walking the opposite direction, and we saw a few other people doing the same, and we kept walking. And by the time, we had walked maybe 20, 30 feet, the whole group had started turning, and it wasn't us leading it necessarily, but everybody had started walking behind us. And we walked for about 2 hours around Hollywood. There was a young gentleman who would run forward to the intersection and make sure cars were stopped and make sure there weren't any police there. And it was so cool how we all came together to make it work. Like if they weren't going to let us walk, we were going to figure out a way to walk.
And you mentioned the importance of unity during times like these, of sort of everyone coming together. And one of course, the platforms that can do that best is music. You are an artist. You were working on an EP. It was scheduled to be released like right around now, but you decided to postpone it. I'm wondering if you could talk a little bit about the decision that you made and how you came to that decision.
Yeah, so I listen, there are a lot of artists right now that have amazing music, and I'm not knocking them releasing their music at any point, whenever they want to. That's their decision and their prerogative. And for me, I felt like it feels weird for me still to kind of just go back to normal when there's still so much that needs to be done. Even on my page, I think the last thing I posted was on Juneteenth, and I'm still like, I don't know how to approach this. I want to post cute things and I want to post DJ and all that, but I also still don't want to forget about what's going on. And I want to make sure that I'm still actively trying to do this work and bring attention to these causes. And so for me, there are some songs on my new EP that are really fun and really upbeat. And I just wanted to take the time to just really look within myself. And right now, I'm just like, okay, I want to get this together and make sure I put it in the right light. And music is definitely healing. And I'm grateful that I got to put out Unknown. And I'm hoping that, in some small way, I can help, people during the day, whether it's like a little mental break that they need, or they just need to cry, or they feel they need to feel encouraged. So I'm hoping that song can do that for them. But I did postpone it till next month. And I just wanted to take time to really cultivate and make sure that I'm doing this in the right way. And for me, it just feels right to postpone it until next month, just so I can really gather my thoughts and how I feel about it. Because the music also changes. It takes on different forms depending on what's happening. So now I'm looking at the music I'm putting out and I'm like, dang, I didn't think of it as, meaning something like that. I didn't know that it could actually, apply to this too.
Right.
So I wanted to take the time to really think about that.
Are you thinking about changing anything about your EP, recording any new songs? Are you writing any new songs? Like, is there anything that's changed about your process?
The songs are still going to stay the same. I'm very proud of the songs that I recorded back in February. For the first time in a long time, I've was able to record music that doesn't have, an experience attached to them, if that makes sense. Like I'm in a very good place in my life. And a lot of my songs on previous albums, there was like, something that would trigger me. And I was like, okay, I have to have this song because I felt it in that way. Or when I was writing, it was out of either pain or, something that was super happy, or a song that was completely outside of my comfort zone, but I wanted to do it anyway. But this particular set of songs came from a really happy place, came from a very loving place. And I don't want to take those off because I feel like we definitely need that. So I have those. Whether or not I add something new, I'm not sure, because I don't think the timing, just with what we have, the process.
It's only got a couple of weeks. Right.
Yeah. So I definitely need that time. But I have been writing and recording, and I'm excited because I'm like, okay, I gotta already look ahead to the next thing I want to put out. So I'm excited that I have material like that I can just be like, okay, we already gave you the EP in July. Let's see what we're doing in the next couple months. So it is really cool to be able to still do what I love during this time. I know that there are a lot of people who are not having the greatest time and who are struggling and who are fighting for justice. There's a lot of things going on. But I'm really grateful that I can still do my work and my job and my passion throughout all of this.
Well, I think that's as good a note as any to end on. Jordin, thank you so much for being here with us. I understand you have one more song to perform, so I will turn it back to you.
Smile, though your heart is aching. Smile, even though it's breaking. When there are clouds in the sky, you'll get by. If you smile through your fear and sorrow, smile, and maybe tomorrow you'll see the sun come shining through for you. Light up your face with gladness, smile. What's the use of sadness, although a tear may be ever so near? That's the time you must keep on trying to smile. What's the use of crying? You'll find that life is still worthwhile if you just smile.
Thank you again to Jordin Sparks for another amazing performance. What a great, inspiring message to go out on. And thanks to all of our guests for being with us today. Another thanks to State Farm, our partner on today's program, for making it possible. We'll be back with another Time 100 Talks tomorrow. Tomorrow's program will focus on the future of sports. We'll be joined by NBA Commissioner Adam Silver, by Mark Cuban, Maya Moore, and Malcolm Jenkins. It should be a great program. If you'd like to join us, you can get more information at time.com/Time100Talks, where you also find info on other Time 100 Talks, past and future. Thanks again for being with us today, and see you tomorrow.